We have with us our expert Dr. Shruthi Reddy, consultant hepatobiliary-pancreatic and liver transplant surgeon, to discuss all your queries on liver transplantation. Good afternoon, doctor.
Good afternoon.
Doctor, please introduce yourself to our viewers.
My name is Dr. Shruthi Reddy. I'm a consultant hepatobiliary-pancreatic and liver transplant surgeon, which means that I'm basically a gastrointestinal surgeon who specializes in three organs, that is liver, pancreas and the bile duct biliary systems. And along with that, I'm a liver transplant surgeon with my expertise being both cadaveric and living donor liver transplant surgeries. I've been associated with Sakra World Hospital for the past few months. Before that, I've worked in many places, including Chandigarh, Delhi, Bangalore in the past, Chennai, and also London, where I've done my liver transplant training.
Excellent. Thank you, doctor. Doctor, here are a few questions from our viewers on liver transplantation. So the first question is, what is liver transplantation?
So transplantation as a term itself means that you're removing something and you're putting something similar in its place. So liver transplantation is just that. Sometimes when people are suffering from a liver failure or a damaged liver which cannot work anymore, and basically the liver's functions in the body is to support multiple metabolic functions, and it also is the most important detoxification organ of the body. It also has digestion. It also supports the digestive systems. So when this liver gets damaged, and sometimes when that damage progresses to what we call as end-stage liver disease, or sometimes acute liver failure, or sometimes in the liver there may be tumors which will develop after this end-stage liver disease, which is cirrhosis. So in these conditions, the only option for the person to survive will be to remove the liver and to put a new liver, either from a brain dead person or from a near relative who is ready to give half his liver for the patient. So this is what is liver transplantation. And what does it entail? So basically we are removing the damaged liver, and there are four important structures to be connected. These are three blood vessels and one bile duct. So we put this graft liver or donor liver, as we say, in the same position, and we join all these structures of the new liver to that of the patient's structures. And after that, we'll close the abdomen, and then this grafted liver or transplanted liver will be able to take over the bodily functions and help out the patient to recover from his illness.
Thank you, doctor. So the second question is, who is a candidate for liver transplantation?
So as I briefly mentioned just now, I would like to classify the candidacy for liver transplantation into four major categories. One is chronic liver failure, also known as chronic liver disease, also known as cirrhosis. That is the most common indication for liver transplantation. Again, the causes for this kind of liver failure are many. What we are seeing of late is we are seeing a lot of fatty liver patients who are coming in, who have progressed to develop liver damage. Also, alcohol, as we know, is a toxic agent to the liver. So these two are the leading causes in India. Hepatitis B and C, the viral illnesses which damage the liver, was a leading cause, but then of late, with better awareness as well as vaccination campaigns, that is decreasing as a cause. So this is chronic liver disease. The second common pathology which requires liver transplantation is acute liver failure, where someone who is otherwise normal has some kind of an insult. Sometimes it's a toxic insult, sometimes it's a viral insult, and sometimes we can't exactly point out what is the cause. In these kind of cases, the person will develop jaundice within a very short period of time, and then the liver will fail so much so that the person will become unconscious, or he'll go into what we call as hepatic coma. During these conditions, again, we might have to do an emergency liver transplantation to be able to save that patient. The third category is liver tumors, as I mentioned, tumors which are limited to the liver but cannot be operated on. That is one more place where we can do liver transplantation. And the fourth category is pediatric diseases. There are many pediatric liver diseases for which liver transplantation is the only hope. And in these cases, we might have to do liver transplantation in people as young as 1 month or less.
Okay. How is a liver donor selected?
So again, liver is not something which can be taken off anywhere else other than from a fellow human being. There is no more, it's not something that you can buy, it's not something that can be produced artificially. And again, there was some news last year about a pig liver being transplanted into a human being, but then eventually it failed. So there is nothing like that. It has to come from human beings only, and this can either be from brain dead donors, someone who's had a head injury or a major intracranial bleed or something, who become brain dead, and if their family is interested in organ donation, the liver as well as kidneys, heart, and whatever organs can be donated will be taken from them. But such donors are far and few. In India, the awareness for organ donation is still not enough for it to meet the requirement of our organ failure patients. So this is the one source. The other source is living donors. Living donors are basically because the liver has the capacity to regenerate. So even if you remove up to 60-70% of the liver from a normal person, it will grow back to its full size in a few weeks' time, and it will keep doing its function normally. So if a person is suffering from liver failure and his relative, a close relative, we say first degree relatives, come forward to donate a part of their liver, we can do that surgery as well. This is called as living donor liver transplantation.
Okay. So what are the risks associated with liver transplantation?
So liver transplantation, if I would like to put it as, it's the most complicated, or the among the major surgeries on the abdomen that we do, liver transplantation is probably the most complicated one. So it does come with a lot of risks, and so the major risk being, it depends on the condition of the patient. Some patients are slightly stable even with jaundice and fluid in the tummy and swelling and some infections and everything. They will be stable enough to go through the surgery without much of complications. Whereas if they come in a stage where they're already in the ICU, they're already not producing any urine, their kidneys have failed, their heart is failing, in those kind of conditions, the complications will be more. So these are critical care related complications, which are not just limited to the liver, but then all the organ systems being involved. So the other specific complications of liver transplantation, if I would like to mention the most common, are during the surgery bleeding and some anesthesia complications, and this new liver that we put in and all the suturing that we have to do might complicate, it might narrow down, it might leak, etc. But these things are something which we have solutions for now. We have further procedures which can be done to be able to help out with these things. The other important complication is infection as well as rejection. Rejection is where the patient's immune system rejects this liver and fights against this liver, and we use medications called as immunosuppressants on liver transplant recipients and any transplant recipients, for example, for that matter, on a long term, mostly lifelong. So these immunosuppressants make the patient prone for infections. And the other complication is sometimes there will be biliary complications which will require further procedures, either endoscopic or through ultrasound guided procedures. So there are some other complications, but then I would say the frequency of those complications are minor, and of late we are having enough of technology available to be able to take care of them.
Okay. So, what is the most common reason for a liver transplant?
So currently in India, the most common cause would be, as I said, uh, both alcohol-related liver disease and fatty liver-related liver disease. Hepatitis was a common cause in the past. Its incidence is decreasing of late because we have better medicines for that. Alcohol-related liver disease, again, it's something that I would like to clarify to the people listening here, that despite it should not be seen as someone is continuing to drink alcohol and we are offering a liver transplantation to such a person despite him not deserving it or something. So alcohol usage disorders are a particular category of psychiatric illness right now, and there are enough measures in place to help these people out, to help them stop alcohol. And when we are offering liver transplantation to someone who has damaged their liver due to alcohol consumption, we take adequate measures to ensure, and we ask them to be sure and show us proof that they've been away from alcohol from anywhere between 3 months to 6 months. Only then we'll be able to offer them a liver transplantation. The other leading cause is fatty liver, as I mentioned, and of late we are seeing up to 20% of our Indian population, adult Indian people, who are coming with fatty liver. This is something which can be detected early and it can be prevented with lifestyle changes. A very small percentage of those fatty livers which come to our OPDs, on the long term, the liver will get damaged and will progress to cirrhosis and will require liver transplantation.
Okay. So, what is the most common infection after liver transplant?
So infections after liver transplant is again a different discussion in itself, if you have to say. Um, the most common, like immediately after surgery, when we keep them in the ICU and when we are giving all the critical care support, during this time they are more prone to chest infections, to urine infection, and as well as the line related infections. That is, we would have placed cannulas in their hands and in their neck, etc. Through that, they might get blood infection. Other than this, on the long term, the actual risk of infection is that of viral infections. And basically, how do we treat it or how do we take care of it? It's a balance. So as I said, it's the immunosuppression which is making them more prone for infections. So we'll have to balance the immunosuppression in such a way that the body is not rejecting the liver as well as the infection is under control. So this balance is what we'll, as liver transplant surgeons or liver transplant physicians, will have to ensure in the months following liver transplantation.
Thank you, ma'am. So, the next question: what is the most serious early complications following liver transplantation?
So I did mention some of the complications like issues with the suturing, the leaks, and the patient himself being very serious before going into transplant, requiring further ICU care or organ support. But then something which is less controllable is the quality of the organ itself. Sometimes there's this condition called as primary non-failure, which is when we do a liver transplantation, despite the rest of the factors being okay, sometimes that liver just won't work. Now the chances of that happening is quite less of late, 1 to 2% we say. Again, there's a multiple factors which go in as to why it won't work like that. So when we remove this liver and we'll store it in ice for maybe 1-2 hours or something before we have to put it back inside the patient. Now this storage period, if it is longer than a certain period of time, the chances of this primary non-failure is more. And again, as I mentioned about fatty liver, now a lot of our donors also are having some amount of fatty liver. We tend to choose our donors in a very specific way, and we take the most precautions when we choose our donors to prevent taking these fatty livers. But in case if there's too much of fat in the liver, that might be one more cause for this primary non-function.
Thank you, doctor. Is there any dietary or social restriction after liver transplantation?
So when we are offering liver transplantation to someone, it's for two things. Both for improving the quantity of life, that is to give this person a chance of surviving for long. This is many a times these are the kind of people who will barely survive 3 months or 6 months or maximum 1 year without a liver transplantation. That organ failure will be so bad. So we are offering transplantation in that stage. Why? Because they can have long-term survival, and we are talking about survival in terms of 5 years and 10 years. We say above 75 to 80% live over 5 years, and the younger the person, they are more likely to survive for longer period of time. And the same thing, other than quantity of life, it's the quality of life that we are trying to correct here. Now, as we probably know already, liver failure patients have jaundice, they have abdominal swelling, they can't eat, they'll feel weak all the time. All of these symptoms, all of these issues will be corrected with a liver transplantation.
How often will I have to go into the transplant institute after my transplant?
So, initially after the transplantation, we will call the person to come as frequently as once in a week or once in 2 weeks. This is up to 3 months after transplantation. We would want to keep a much tighter control of the medications that they are taking, and just looking at the person might require frequent blood tests, etc. Over time, I think towards the first year of surgery after transplantation, so the patient might have to come to the hospital once in 3 months, and after 5-6 years they'll end up coming once in a year, as long as they are taking their medications regularly and on time.
Thank you, doctor, for your valuable insights. With this, we come to end of today's live show. Thank you, viewers, for joining us. If you have any queries, you can leave a comment, and our expert will answer them for you. Thank you.
Thank you.